As we take a look at the posterior abdominal wall, we're going to explore 4 muscles. This model is essentially the posterior wall of the body. As you can see, this is the rib cage, here's the spinal cord, here's the last rib, and then here's the iliac crest, and then down here would be the sacrum. So getting orientated, if you could imagine, this is like the back of your hips, and then here's the bottom of your rib cage, and then just tucking your hands behind kind of essentially the lumbar area of the body. So we have 4 muscles altogether that I had asked you to delineate and describe. Here's the first one. These are our 2 major powerful hip flexors. So we get the first one called the psoas major. You can see it's a large bat-like muscle. I always think it looks like a baseball bat. And right next to the lumbar vertebrae, it comes down and goes into the lesser trochanter of the femur. Along with it is this one that originates in the iliac fossa. When these guys come together and pass the inguinal ligament, they become what we call the iliopsoas. And that is a major, as I said, powerful hip flexor. So if you're doing Muay Thai or doing kind of like high knees to somebody's face, that's essentially what you want. Very, very powerful psoas major and iliacus muscles. You'll notice a muscle on top of psoas major right here turns into a tendon and actually goes down to the pubis. And so it actually doesn't do any hip flexion, it kind of does like this hip tilt. So this is called the psoas minor muscle. Right there. It's just a small, slight tendon coming on the psoas major, and that's where you'll find it. In addition, the last muscle, the posterior abdominal wall, would be this one that spans from the iliac crest up to the last rib. And this is what we call the quadratus because it has 4 sides. Lumborum, quadratus lumborum. So that one helps tilt your back and or spine, tilt it, lateral flexion as we term it. And so 4 muscles altogether, let's review. Psoas major, iliacus, psoas minor, and quadratus lumborum. You can also still see psoas major and iliacus on the Somso model, which is located here. As you can imagine, this does include the lumbar vertebrae, and then here's the iliac crest, and here's the pubis. And so again, this one right here is psoas major, as you can see, psoas major, and allows to, you could actually then see here's the iliacus coming down, and then from there, when it passes the inguinal ligament, it becomes the iliopsoas. So you could call this iliopsoas, and then up here psoas major and iliacus. Again, this one doesn't have the psoas minor nor the quadratus lumborum that would extend above the iliac crest. But let's just review again: psoas major, iliacus, iliopsoas. On here, psoas major, iliacus, and then psoas minor, and then quadratus lumborum.